Gentlemen, I'm going to be very honest with you. If you've been noticing weaker erections, softer performance, or just less sensitivity than you used to feel, it's not always just age. A big part of the problem may actually be the way you masturbate. Yes, I said it. The private habits you've built over the years could quietly be training your body into erectile dysfunction. And here's the kicker. Most men never talk about this. Worse, they keep repeating the same four mistakes that weaken blood flow, numb sensitivity, and sabotage performance over and over. In today's video, I'm going to reveal the four biggest masturbation mistakes that set men over 50 up for failure. And more importantly, I'll show you exactly how to fix them naturally. Stay tuned until the end because once you correct these habits, you'll notice firmer erections, better prostate health, and a powerful return of confidence and pleasure. Let me start by saying this clearly. Erectile dysfunction is not just about getting older. Yes, it's true that testosterone levels gradually decline as the years pass. Blood vessels naturally lose some flexibility. The tissues that once responded instantly now need more encouragement. But here's what most doctors won't tell you. The way you've been stimulating yourself, especially if you've been doing it the same way for 20, 30, even 40 years, has actually been reshaping your entire nervous system, your circulation, your hormonal response, even the way your brain processes pleasure. Think about this for a moment. Your brain and body are incredible learning machines. They're always adapting, always responding to patterns. If you repeat a certain type of stimulation consistently, your system learns to expect it, to require it, to depend on it. And that's where the problem begins. Many of the habits men develop, habits that feel completely normal and natural, are actually working against the body's design. Over the course of years and decades, these patterns desensitize your nerves. They restrict the flow of oxygen to critical tissues. They condition your entire arousal system to respond only to artificial, intense, or rushed stimulation. But here's the truth that should give you hope. Just as poor training creates dysfunction, intelligent retraining can restore function. Your body wants to work properly. It's designed for pleasure, for connection, for vitality. When you give it the right signals, it responds, sometimes faster than you'd expect. You are not broken. You are not past your prime. You simply need to identify the habits that are working against you and replace them with practices that support healthy blood flow, natural sensitivity, and genuine confidence. That's exactly what we're going to do today. Let's dive into the four most damaging masturbation mistakes that silently create erectile dysfunction, and more importantly, what you need to do instead to reverse the damage and reclaim your natural function. The first mistake, and perhaps the most widespread, is relying on adult content every single time. Let's address this directly because it affects millions of men, and most don't realize the damage until it's already done. Using adult videos or images every time you masturbate might seem harmless at first. It's exciting, it's convenient. A screen gives you instant access to endless novelty, endless stimulation, endless intensity. Whatever you want, whenever you want it. But your brain was never designed for that kind of input. Your natural arousal system evolved over millions of years to respond to real-world experiences. Touch, scent, imagination, anticipation, the subtle dance of connection with another person. When you constantly flood your brain with extreme, on-demand stimulation, it adapts in the wrong direction. Biologically, you begin requiring that artificial level of intensity just to trigger the release of dopamine and nitric oxide, the essential chemicals that kickstart arousal and enable blood flow to the penis. Emotionally, real intimacy starts feeling too slow, not stimulating enough. Your expectations become warped. Practically, when you find yourself with a partner, or even alone without a screen, you struggle. Erections fade before they fully form. Sensitivity feels muted. Performance anxiety creeps in because your body is waiting for a type of stimulation that isn't coming. Here's the hopeful part. You can retrain your brain. It takes patience, but it works. Step away from the screen. Instead of reaching for your phone or computer, practice using natural cues. Use your imagination. Replay a real memory. Pay attention to physical sensations, to touch, to the rhythm of your breathing. At first, this will feel awkward. You might not respond as strongly or as quickly. That's completely normal. It's detox. Your brain is recalibrating. But within a few weeks, something remarkable happens. Your sensitivity begins to rebound. Erections come more easily. Arousal feels natural again, organic, connected to your body instead of to a screen. Remember this. Your brain is your most powerful sexual organ. When you train it correctly, it rewards you with function, pleasure, and confidence. The second mistake is misusing edging. Now, edging, the practice of bringing yourself close to climax and then pulling back, can actually be a powerful tool when done properly. It builds stamina. It increases ejaculatory control. It can make the eventual climax significantly more intense and satisfying. But many men take it too far. They push themselves right to the very edge of orgasm, then stop abruptly, again and again, sometimes for an hour or even longer. Biologically, this confuses your entire system. One moment you're demanding maximum arousal, maximum blood flow, maximum nerve activation. The next moment you're slamming on the brakes. Your pelvic floor muscles become exhausted from the constant tension. Your nerves stop firing in their normal patterns. The delivery of oxygen-rich blood to your erectile tissue drops off. The result is predictable. You either struggle to finish at all, or you finish far too quickly when you finally allow it. Erections weaken over time. Sensitivity becomes unreliable. You've created the exact opposite outcome from what you wanted. The solution is practicing balanced edging. Don't push yourself right to the cliff's edge. Pull back earlier while you're still fully in control. Limit your edging sessions to 15 or 20 minutes maximum. Always allow a natural release at the end so your body can complete the arousal cycle it's biologically designed for. When you approach edging with balance and respect for your body's limits, it strengthens your system instead of exhausting it. The third mistake is rushing through the entire experience. Think back to when you were in your 20s. Testosterone was sky high. Your blood vessels were flexible and responsive. Your nerve endings were razor sharp. You could rush to climax and your body would bounce back almost instantly. But after 50, everything changes. Blood vessels lose elasticity. Testosterone levels drop. The nerve endings in your pelvic region gradually lose sensitivity. So when you rush now, your erectile tissue never gets the chance to fully engorge with blood. Oxygen delivery is cut short. And here's a critical point. When tissue doesn't receive adequate oxygen over time, it weakens. Erections become short-lived and unreliable. Climax feels hollow, unsatisfying. Emotionally, you feel frustrated and disconnected. Practically, you've trained your body to expect brief, weak responses instead of full, powerful ones. The solution is beautifully simple. Slow down. Make it intentional. Focus on your breathing. Take a deep inhale through your nose. Release it slowly through your mouth. This single practice boosts nitric oxide production and helps relax your blood vessels, improving circulation. Pay attention to your muscles. Release tension instead of clenching and gripping. Let arousal build gradually, like a slow-burning fire instead of a quick flash. When you do this consistently, erections become noticeably firmer because they're supported by full, sustained blood flow. Climax feels richer and more powerful. If you're with a partner, intimacy stops feeling like a sprint and becomes an actual experience you can enjoy. Every single time you slow down, you're sending a signal to your system. You're retraining it for strength and endurance. The fourth and final mistake is the death grip. You've probably heard this term before. It refers to using very tight pressure and fast, aggressive friction during masturbation. In the moment, it feels intensely stimulating, but over months and years, it systematically desensitizes your nerves and damages your natural response. Here's what happens on a biological level. Constant compression reduces blood flow to the sensitive tissues. Your nerves adapt to harsh, extreme stimulation, which means light or natural touch no longer registers as pleasurable. Erections become harder to achieve and maintain. The pleasure you do feel becomes muted and dull. Emotionally, it's incredibly frustrating. You wonder why you can finish easily on your own, but struggle completely when you're with a partner. Practically, you've conditioned your body to need a level of pressure and friction that's impossible to replicate during normal intercourse. The fix requires conscious retraining. Loosen your grip. Use a lighter touch, even if it feels less intense at first. Vary your strokes, your rhythm, your technique. Introduce lubrication to reduce friction and protect the delicate skin. Think of this process as rehabilitation for your nerves. In the beginning, it will feel weaker, less satisfying. But within a few weeks, your sensitivity begins to return. Erections come more easily. Pleasure feels richer and more natural. Intimacy with a partner stops feeling impossible and starts feeling enjoyable again. By releasing the death grip, you're not losing intensity. You're reclaiming your body's natural capacity for pleasure. So here's your complete roadmap for restoration. Step away from constant adult content and retrain your brain to respond to natural cues. Practice balanced edging instead of marathon sessions that exhaust your system. Slow down your pace and focus on breathing so your circulation can do its job properly. Lighten your touch, use lubrication, and give your nerves time to heal and recalibrate. These 4 shifts alone, implemented consistently, can completely transform your erections, your confidence, and your capacity for enjoyment. And I want you to really absorb this message. If you've been struggling, it does not mean you're broken. It does not mean you're too old or that your best years are behind you. It simply means your habits have been training your body in the wrong direction. But your body is remarkably adaptable. With small, intentional changes, you can retrain it and bring back the strength, confidence, and pleasure you thought were gone forever. Imagine waking up and looking forward to intimacy again instead of dreading it. Imagine feeling proud of your performance instead of anxious about it. Imagine feeling genuinely connected to yourself and to your partner, present in the moment instead of trapped in your head. That future is 100% possible for you, regardless of your age. Erectile dysfunction is not simply an unavoidable part of aging. More often than not, it's the direct result of habits, patterns you've repeated for so long they've become invisible. The wrong habits weaken you gradually, almost imperceptibly, but the right habits restore you, sometimes faster than you'd believe possible. Here's my challenge to you. Pick just one change from what we've discussed today and start implementing it tonight. Step away from the screen, slow down your pace, loosen your grip. Whatever resonates most, just start there. Because every small shift you make is a signal to your body that you're not giving up. You're investing in your vitality. You're choosing to reclaim what's yours. And when you practice these changes consistently, you will notice results. Firmer erections that you can trust, deeper pleasure that feels genuine and satisfying, a confidence that makes you feel like yourself again, maybe for the first time in years. This is your health, your confidence, your life. It's time to take it back.